Exactly. I will give a brief كده about updates in vitrectomy machinery. First of all, I have no financial disclosure regarding any of the names mentioned here. There will be a lot of things actually. To know what's up to date, you need to go back a little bit. So we're gonna take it from the start. الموضوع ابتدى في 1970s with the pneumatic cutters and single port systems by Robert McCamara. It was called the VISC, Vitropage Instrumentation System for Core Vitrectomy. It has one infusion, aspiration, and cutting port. The three were in a single port. It was 17 gauge up to 20, but actually mainly it was 17 gauge vitreous cutter, pneumatically driven, guillotine type cutter, just like Dr. Tarek said. It has a very low cut rate, 200 to maximum 400 cut per minute. It had external fiber illumination too. Actually, it was too old even to find an image for it. The issue here was that the instruments were so bulky, high retinal traction and risk of retinal injury was so high, it had a single port, and that wasn't practical at all. So in 1980s and 1990s, we went to the second generation, or linear control and dual functionality. Meaning, started to have separate infusion and aspiration cutting ports, not just a single port. The linear foot pedal control for aspiration and cutting. It's 20 gauge now as a standard. The cut rate increased up to 800 cut per minute. The light was xenon or halogen illumination. One of the machines was the Accuracy of Alcon, Millennium of Bosch and Lomb. That's not so much available right now. And then we went to the third generation, 2004 up till now. That started the small gauge vitrectomy system and the higher cutting rates, the 23, 25, and 27 gauge transconjunctival sutureless vitrectomy system. The smaller ports allowed for faster wound healing and less inflammation. Now we have dual pneumatic cutters from 5,000 up to 10,000 cut per minute. Integrated intraoperative illumination and laser. It used xenon illumination, and chandelier ports were introduced too. Now we have real-time IP compensation, just like Dr. Tarek was saying right now. It's automatically adjusting the intraocular pressure. The Constellation Vision System by Alcon, the ERA by Doric, the standard one, and the Stellaris PCA from Bosch and Lomb. These were the three main. And finally, the fourth generation, from 2010 to now. Ultra high cut rates and digital integration. The standard there is 25 and 27 gauge technology. It used hypersonic vitrectomy, meaning it increased the cut rate up to 20,000 cut per minute. Some machines are using the ultrasound energy. It's not mechanical, it's not pneumatic anymore, it's ultrasound energy. It has dynamic IP control. Xenon and LED is now used in illumination. It has voice control systems like AI assist and digital integration like 3D displays and Ingenuity. Just to make it clear, between xenon, LED, and halogen. Halogen is the first one used, it's very old. Xenon and then introduced, and now the LED. The LED provides the highest illumination with the least heat emission. Examples for these is the Vitas Bush and Lomb Surgical. This one had the hypersonic cutter with no guillotine that uses ultrasound energy. The Eva Nexus, the Unity by Alcon, and the Goiter Megatron S4 HPS. In a nutshell, the difference between the four generations. First, vitrectomy of the camera would have a single large port, high traction risk, basic removal of the vitreous in RD and endophthalmitis that had limited safety. The second generation introduced dual control, separate infusion and coloring, and 20 gauge standardization. That was a bit safer and standardized the retina surgery started. Third generation was the micro incision, introducing the 23, 25, and 27 gauge, dual pneumatic, IP control, and enabling many invasive vitrectomy surgery and delicate macular surgery. Finally, the fourth generation, the ultrasound cutting, smart fluidics, and 3D visualization that allow precise retina surgery, less traction, faster recovery, digital navigation, and full integration of the 3D adjustment and ingenuity. And still, we're gonna have more and more. Thank you.